Do you wonder if you're the best version of yourself? This is the question we seek to answer in this podcast. We reveal information that helps you recover your health and become resilient. Modern life makes us fragile. Our diet, lifestyle, and environment set us up for failure. We do not accept this. We seek optimization. We strive to become dynamic. Hey, what's going on? Dr. Chris here. Today I'm going to play a recording. So I put together a presentation for the physical therapy students at FGCU, my alma mater. And I wanted to have a pre-recording that I can give to them so they didn't have to take notes. So what I'm going to do is play the pre-recording for you guys. I think it's relevant to this podcast. Also, the actual presentation with the slides, which would be really helpful to go along with, is on YouTube. Just Google Science of Breath on my YouTube channel. Probably better to watch it there. Okay? I hope you guys enjoy this. All right, so let's dig into it. So I'm going to start off with a few quotes. This is an old Chinese adage. What the bodily form depends on is breath, and what breath relies upon is form. Now, I like this because it shows sort of the cyclic manner in which breath and the body kind of work together. And you can, it's a two-way street. So you can watch how someone's breathing and tell what state they're in. And then you can also reverse engineer and change the state they're in by changing the breathing mechanics. Here's another one from a famous physical therapist, Gray Cook. If you can't control your breath, you can't control your movement. I love this one. And I saw Kelly Starrett I think he maybe changed it a little bit, which he says, if you can't breathe in a certain position, you don't own that position. So, and I see this all the time. You see an older gentleman with a big belly, he wants to get off the couch or off a chair, and he tries to stand up, and he holds his breath, and face turns bright red. That's a sign that he does not own the ability to get out of a chair comfortably. Or maybe you're a CrossFitter, you're doing a pistol squat, and it's hard for you to do, and you're holding your breath doing it. It's okay. You don't own that position truly until you're able to breathe with it. And I think this holds true for not just body position, but athletic performance in general. So the Olympics just passed, and I was a big fan of watching Sha'Carri Richardson run. And all the elite runners, if you watch them, they are sprinting top-notch, unbelievably, with their mouth closed, breathing through the nose. They own that. So some things we'll go over in this presentation. We're talking about some breathing fundamentals, some of the physiology, what happens to our blood gases, the Bohr effect, which is really interesting, and also the effects of temperature on blood gases. Then we'll go into some assessment. We'll look at breathing mechanics, talk about mouth versus nose. We'll talk about the Bolt test, and a topic that sort of overlaps, which is HRV, heart rate variability. Then we'll discuss 4 different types of breath. Just so you know, there are tons of different ways to breathe. I just picked 4 that I thought were relevant and that can be accessible to anybody and something you could use clinically. And then we'll go into some of the implications as a physical therapist, how breath can affect your lymph, how it can affect your back pain, some special topics like sleep apnea and physiologic flexibility. And before we dive into this more, I want to do a quick quiz. So this is, again, meant to be a quiz for my physical therapy students. So I'll just, for the sake of this presentation, I'll ask the question, give a small pause so you can think about it, and then I'll give the answer. So the autonomic nervous system is comprised of what 2 systems? You've got the sympathetic system and the parasympathetic. The sympathetic is fight or flight. Parasympathetic is relax and digest, or some call it the feed and breed state. I'm going to focus a little more on sympathetic for this little quiz here. So what are some of the main hormones that or chemicals released by the body when you're in a sympathetic state? Okay, so you've got epinephrine, norepinephrine, and cortisol. Cortisol is what's known as the stress hormone. It kind of has a bad rep, but it's a good thing our body produces cortisol. It is a necessary chemical when in a fight or flight state. The problem is a lot of us live in a fight or flight state and we're not truly in one. So when cortisol is pumping through the body, what does that do? It releases sugar or glucose into the bloodstream. And why is that? Well, we have 2 main sources of energy. There's more than that, but the 2 main ones our body likes to utilize are They're fats and glucose. And glucose is more readily available. So when you need quick energy, the body secretes cortisol, which turns into sugar release, which becomes quick energy for fight or flight. Now, as I mentioned earlier, a lot of us live in a sympathetic state all the time because work, because finances, because taxes, because who knows what. And that what that does is keep cortisol pumping through our body. And if you have sugar being released constantly, what hormone is released to counteract that sugar? Insulin, right? So over a lifetime of producing tons of insulin to deal with the blood sugar, because you don't want too much sugar in the blood for too long, you become what? Insulin resistance, which then leads to diabetes. So I want you to keep that in the back of your mind as we go through this presentation. All right, so why do we care about breath? Why is this important? What is normal? All right, so most textbooks will say, and I certainly learned, 12 to 20 breaths per minute is considered normal. Some would argue 6 to 10 breaths is normal. It depends who you ask. I think a lot of research needs to be done on this. There's a lot of preliminary work on overbreathing, how most of us tend to overbreathe, and that causes all kinds of issues. So in the book Breath by James Nestor, he says 6 to 10 breaths is ideal. Now, when you extrapolate that out, if you are in the quote-unquote normal 12 to 20 breaths, that's 28,000 plus breaths per day. If you're doing more 6 to 10 breaths, we're looking at 8 to 9,000 breaths per day. Now, if you've got some faulty mechanics and you're doing 29,000 cycles of that a day, you can imagine how things can spiral out of control rather quickly. All right, breathing has a strong effect on our blood gases, our ABGs. You can quickly alter your pH. So I want to quickly review the pH scale. So it's a 0 to 14 scale. 7 is in the middle. 0 is, or the lower you go, the more acidic you become, and the higher you go, the more alkalinic. Now, when you have higher levels of oxygen in the blood, that makes you more alkaline. And as carbon dioxide builds up, as in conditions such as COPD or just holding your breath, you become more acidic. So when you're higher on the alkalinity scale, that's called respiratory alkalosis. And if you're lower, that's called respiratory acidosis. And here is the chemical equation for inspiration. So hopefully you guys recognize that first molecule from high school chemistry. C6H12O6 is glucose plus oxygen yields carbon dioxide, water, and energy. So I like that equation because it shows that how we take sugar and air and turn it into energy. And that's what breathing really is. It's the utilization of air and converting it into energy. Now, this shows how CO2 buildup turns into a more acidic state. So when CO2 rises, if you're doing a long breath hold, or you're a free diver or something like that, or you have COPD, carbon dioxide binds with the water in our blood. That turns into carbonic acid, which very quickly associates to bicarbonate and hydrogen ions. Hydrogen ions are acid. Now this equation goes the opposite way too. So bicarbonate is the buffer for hydrogen ions. A side note, there's also carnosine, which also can buffer the buildup of acid in our tissues, particularly at the muscle level. Now carnosine is made from beta-alanine and histidine. Beta-alanine tends to be the rate-limiting part of that equation, so that's why taking beta-alanine as a supplement can help improve exercise tolerance, because it creates carnosine, which then buffers the acid that you feel when you work out. Up next, we have the Bohr effect. So this is a very important concept to understand. The need to breathe. A lot of people would assume it's the lack of oxygen. It's really the buildup of CO2 in the bloodstream. So we have chemoreceptors that can sense how much CO2 there is, and people have different sensitivities to CO2. But that is plastic. You can improve that. That's exactly what free divers do. In fact, there is a Croatian free diver. His name is Budimir Sobat. I'm not sure if I'm pronouncing it right. Sorry about that. But he's able to hold his breath for over 24 minutes underwater, all from training the chemoreceptors for CO2. So what the Bohr effect is the more you can hold CO2 into your bloodstream, the more it sort of scrubs off or pushes the oxygen from the hemoglobin into your tissue, so it delivers more oxygen. So some would call this the oxygen advantage. All right, let's talk about temperature. We get these questions a lot as physical therapists. Should I heat it? Should I ice it? What should I do? I personally never ice my injuries, and here's part of why. So as temperature rises, more oxygen is delivered to tissues, and the converse is true for cold. So as temperature decreases, oxygen binds more readily to hemoglobin. So in a lot of painful situations our patients go through, we know there's tissue ischemia. So picture, like students that sit in front of a laptop all day. Those middle traps are put on the low load, long-term stretch. The tissue becomes ischemic, and you develop what we call trigger points. So in those scenarios, I want more oxygen to the area, not less. Just a little food for thought. All right. Assessment. So we have their breathing mechanics, their breathing pattern. Are they breathing through the nose? Are they breathing through the mouth? And we'll talk about the Bolt test and HRV. So we have our normal breath, which should look like belly rises on inhale, and then the chest rises. Right? So diaphragmatic breathing is what that's called. So air is supposed to come in through negative pressure like a bellows as the diaphragm descends, which pushes the abdominal contents up. And as you exhale, that all collapses down. And then we learn that patients with COPD, they develop a paradoxical breathing pattern where they lead with their chest, that bucket handle approach to breath. So it's basically breathing with all their secondary muscles, such as their scalenes, their pecs, anything but the diaphragm. And over time, the diaphragm gets weak, and it's less efficient. So when I learned about this in school, I just thought, okay, that's only patients with COPD. But anybody who lays on my table in my clinic, one of the first things I do is watch how they breathe. And I will say 9 out of 10 people are breathing paradoxically, sort of chest first breathing. And why is this? Well, it turns out that the way you breathe is significantly tied to your nervous system, your autonomic nervous system. So belly breathing, diaphragmatic breathing, is highly associated with the parasympathetic division, whereas chest dominant breathing is highly associated with the sympathetic division. And this makes sense. I mean, picture somebody in like a bar fight or something like that. Their chest is going to be heaving. And this can lead to all kinds of issues when done chronically. For example, if you're using those secondary like neck muscles, for example, to pull up on your rib cage constantly, you're going to develop some stiffness in the neck. So I hear a lot of my patients say, "Oh, I hold my stress in my neck or my traps," right? Well, I always say, well, it's because you're breathing with your traps. And the same is true for nose versus the mouth. So the mouth is highly tied to the sympathetic division, whereas the nose is highly tied to the parasympathetic division. And something that's kind of interesting too with the nostrils is that one nostril is paired to the parasympathetic division, that's the left nostril, whereas the right nostril is paired with the sympathetic division. So you can kind of use this. If you're in a sympathetic state, like say you have to give a presentation, you're nervous, before the presentation, you can just take your thumb, cover your right nostril, and breathe through your left nostril for a few minutes, and that should theoretically trigger your parasympathetic division and help calm you down. In fact, there was this fascinating study about this woman with schizophrenia who was having constant hallucinations, and it turned out her right nostril was blocked. And just by giving her some right nostril breathing exercise, it was able to reduce her hallucinations. So let's move on to the Bolt test, something you can kind of quickly and easily do to assess someone's stress and their CO2 tolerance. So it's called the Bolt test. So what you have to do is take a normal breath in and out, do several rounds of that, just normal breathing. And then when you decide to start the test, do a normal exhale, not a max exhale, but a normal exhale. Take your fingers, plug your nose, and count. And see how long you can go for. You stop the test when you feel the first urge to breathe or you have some sort of symptom like your throat closing. If you have to take a large breath after the test, you've held your breath too long, you may need to repeat it. So if you want to test this before I go on to the next slide, go ahead and pause the video now. How did you do? So average tends to be about 20 seconds. 25 to 40 seconds is ideal. If you're under that, you're probably sensitive to CO2. This is kind of a snapshot too. It's finicky. It's kind of like heart rate or blood pressure. It depends on your state. So this is really like a good litmus test to see what type of stress state you are in. If you're poorly slept, for example, you're going to tend to do worse on this test. HRV is another great measure. You need a device to do it, such as the Morpheus or the Whoop strap or Oura ring. They measure heart rate variability. And what that really is a measure of recovery or a return to baseline. So the idea is, this is a kind of complicated topic. You can make a presentation on HRV alone. But HRV really means, if your heart is beating 60 beats per minute, it's not actually beating like on the second perfectly. There's variance, right? So as we inhale, our heart rate increases slightly, and as we exhale, it decreases slightly. So there's this bit of like a yin-yang, a sort of a plus-minus that is normal. So it's a bit counterintuitive, but basically the higher the HRV, the better state you're in, and that is highly associated with your recovery. So for example, I use the Morpheus watch or strap. It's just a quick little 2-minute test you do in the morning. You run the test, and you just sit there and breathe normally while it runs, and it'll spit out a recovery score. And that number is both an assessment and a way to guide what you may do that day. And so this is an equation I love. It's stress plus recovery equals adaptation. So adaptations, it's whatever you want to be. Is it stronger, faster, perform better? That's the goal, right? And how do you do this? You add a stimulus or stressor like exercise, and then you need to recover. So that usually boils down to sleep and some lifestyle things. But the recovery component is the one that everyone forgets about, and this is what HRV is really measuring. So if you had a heavy workout and your recovery score is, say, 60%, you're not fully recovered. So you either worked out too hard, or you didn't sleep well enough, or you stayed up too late on your phone or Netflixing, and that may guide your decision about what to do that day. If you have a 50% recovery score, maybe you don't want to set a PR in the gym that day. Maybe you want to do some light aerobic work. Conversely, if you worked out and you're 100% recovered, well, you may have had some awesome sleep, but maybe you didn't work out hard enough, right? So the ideal is if you've had a pretty good session and you slept well, about 85% recovery, something like that, that's kind of what you're shooting for, right? Because this is the goal. You've probably heard the analogy of the bucket or the glass. You want to become more resilient, you want to become better. So if you're pouring water into a small bucket, it will eventually overflow. And the answer is not just pour more water in, it's just going to continue to overflow and exceed your capacity. So the answer is to build a bigger bucket. But it can be problematic or difficult to build a bigger bucket if you've got holes in your bucket. So all the stressors or exercise in the world won't do you much good if you've got holes in the bucket. You first have to plug those holes as much as you can, and then you can apply the right stress, and then you get your bigger bucket. So what are the things that create the holes? It's all things we know we're not supposed to be doing, right? It's the number one by far is poor sleep or lack of sleep. That falls in line with some lifestyle choices, avoiding too much blue light at night and not getting enough sun during the day, excess caffeine, chronic stress, caloric deficit. So I put that one there because it is a type of stressor. There's a lot of benefit to fasting, but I see a lot of guys my age that they're fasting all day and they're sprinting on the rower and working out and they're exhausted. It's too much. So you have to be strategic with using fasting. And then, of course, breathing mechanics is how this all ties together, right? So if you're chronically chest breathing, chronically sympathetic, that is a big stressor, especially when you're doing it 29,000 times a day. So dial those things in, work on breathing mechanics, prioritize sleep. A lot of people will get up at 4 o'clock in the morning and do their cardio. Well, Stan Efferding has this great quote. That's like stepping over $100 bills to pick up dimes. Next, let's get into types of breath. So I just picked 4 things to talk about. Sympathetic breath is what we'll do at the end of the presentation. I call it the breathing spin up. It's a great thing to do before workout. And that's basically the Wim Hof style of breathing. Parasympathetic breathing, that's more the belly breathing, right? That's a great way to wind down your day. I tell my patients to do that at the end of the day, especially if they're having trouble falling asleep. It really helps with recovery. Box breathing is one of many ways to improve your CO2 tolerance. So what that looks like a typical box breathing style would be 4-4-4-4. So that'd be a 4-second inhale, a 4-second breath hold, a 4-second exhale, and then a 4-second breath hold and repeat. So it's actually